to do today is actually something, a talk that probably you heard a part of it before, is we are talking about publishing papers, but I want to talk about how can you improve your chance to get your paper accepted. As you know, all now in the university, there's pressure for our researcher to publish, and then there is many journals. And speaking to people from Turkey, I'm originally not too far from Turkey. I was only 40 kilometers from the Turkish sort of border, but my journey took me to England and to Canada, and now I am the Vice Chancellor and Dean in Sharjah. I learned it the hard way, so I want to just pass some of my experience to the researcher here and to tell them how can they improve their chance of getting the paper accepted. And this is coming from an experience of almost 35 years that I have to learn this from scratch. And being an editor of a journal with an impact factor of 14 and another journal with an impact factor, also high impact factor, and now we initiate our own journals. So I just want to give some tips because, which is accumulated there. Now, the first thing for any of the academic or researchers, they have to ask themselves why they want to publish. There's many reasons for people to publish. A lot of people, maybe in that piece where I am or in the Middle East, they want to publish to be promoted, but that's not the main reason you should look at it. To advance science and knowledge, to improve your institute reputation, which is very good. We all look for the ranking, and to our method, from, in the last 5 years, for example, in our university, we brought, with the publication, we brought our ranking almost 500 point down. To make the money, you're going to be surprised that we can do that. And some people, they wanted to please their supervisors. And some people, they want to stay in the job, and now if you don't get promoted, then you cannot stay in the job. And other people do it for the courtesy. Now, the reason I'm putting that is there's a number of reasons, and that creates some pressure on our researcher and on our faculty to publish. Now, I'm glad that you really got this workshop about the ethics, because we have to learn that, the pressure on publication should not lead anybody to do the wrong things. And we should always respect the ethics in the authorship, in the ethical approval, in the copyright, in all these. I'm sure you will hear from the other speaker. We already heard from them as that one. Now, I have noticed that when, I was in sort of thing in Canada, and there was something called Publish or Perish. And people have really pushed a lot of their fellows to publish, and then they publish some data that is not reproducible. And that's something that I can tell you, a lot of data that has been published and still being published now in some of the journals, especially the one which is not very high rank and is not repeatable, even in Nature, even in New England Journal of Medicine. So please do not get the pressure to get into you to try and really try to have a shortcuts, because it will end up into something that you don't like. So we should, I think the main reason we should publish, those all are legitimate reasons, but we would like to advance the knowledge. Each publication, as an editor, when I look to any publication as I ask the question, does this paper give us any additional knowledge? If it gives us even, you don't need to give a big additional knowledge. If it gives us a small additional knowledge, then you are already, your foot is in the door. Now, the message that I'm going to tell our people here in your place, there's too many journals. There's too many journals in the medical field. And now, every now and then, you receive people asking you, please, we are very impressed by your work. Can you, this is open access journal, send us your paper, and then they'll end up asking you for money. And you have to be very careful in choosing the journals. So there is too many journals, and you have to be very familiar with the journal in your field to really have a good chance of getting your paper into the right journals. It has to be a journal that people read. Now, other thing I noticed in the recent sort of paper I received for review is people do not read. The internet has, before, when we were young, we used to read the whole paper. We used to go and read the journals. Now a lot of people read the titles, the abstracts, and the best way really to learn how to write a paper is to read papers, to read it full and read the journals, know what this journal is publishing, what type of paper is publishing. So do not only read the titles, read the papers, which is really some of our young investigators now that unfortunately they don't do, and they end up with quoting their own papers, which is really unethical here, or sometimes, trying to probably do work which is already being published. It's not a bad idea for a university like ours or yours to give courses to medical writing. We all are not, I speak English, because I learned it. I speak French, but my original language, we are not it's not our mother language, and all the journals now in English. So we should really learn how to write the papers in the medical way, and really avoid translating. When you translate it from your own language to an English language, that's what I found a bit, you are telling a different story. You have to think in English. You have somebody who speaks good English has to help you to write. So taking a course, and I just want to give you my experience, in this one. When I was doing my PhD in clinical training in England in the 80s, the first paper I wrote, I presented to my supervisors, and then she threw it in the garbage bin. And she said, "What's this garbage?" The British people there. And I said, I was very offended, but she sent me to a course, to a 1-week course in the University of London. That course has opened the door for me, to now, at least, I have 600-700 papers now published in good journals. But that course has given me really, and now we send our fellows also to do the similar course. So I will advise that you might sort of establish a course to help our students, our fellows, our even faculty how to write a paper. Now, the other thing in the papers that we review every day, and I spend years reviewing papers, is that the message that you want to get into the paper, it should be simple and straightforward. Editors are not very interested in complicated sort of writing and complicated messages. They all are busy. They want to see a simple, straightforward message which is clean. And that is something that I will advise everybody to do. There's no room for personal style, that this is the way I write, or rambling, or inaccuracy in scientific writing. You have to be very careful. And when I say about that, we're talking about journal, which is a Q1, what we call, or Q2, or do good journals that you need to publish in it. Now, not every journal has the same style. We have, as I said, more than 5,000 medical journals. So that is at least the one which is citable. Some journals, you have to know which journal you are sending your paper to. And you have to read instruction to the author, and follow that. For example, follow the way that you write it. Some papers, a lot of the journal now, they want you to present your ethical approval. And that, if you don't present it, you might decrease your chance of getting this paper accepted. You have to justify, as I'm going to talk about, the contribution of the authorships. And we'll talk about that in a minute. So you have to read the journals and see the style. If you are an immunologist or if you're a clinical sort of endocrinologist, you have to read those type. And there's also some of the general journals. You have to know the style before you send the paper for publications. Now, so how do you choose your papers? How do you choose your paper? You have also to look to a few things. And these are something that I'm sure you're all familiar with. But when a lot of people I find they are not familiar with. So I'm sure you're all familiar with PubMed, and now probably Scopus. You have to know what is this. You have to know about the impact factor of that journal. I'm not saying we should only publish in high impact, but you have to publish for the highest impact factor in your field. Try this one. There's nothing wrong with trying. But if you have a simple message, do not go to an impact factor, which is 20 or 30 or even over 10. So you have to know what is the impact factor, because that indicates the difficulty that your paper will get accepted in this journal. So that is an important thing. Now, citation index, that's more for yourself to know the citation index. The edge index, an important thing now for individual people and for the journal itself. And the edge index is the way that, the number of time that this paper or a number of paper has been cited. So, for example, if you are a faculty, we will expect you to have an impact factor, 20, maybe 15 to 20, 30. If you want to recruit somebody and he has an edge factor of 50, he's an excellent person. If you have over 100, you are an outstanding person. So this is things that you are also to understand, please. Now, I want to emphasize on this. A lot of the journals are online. That doesn't mean that the journal are online, which is not good, but there is a lot of online journals now that are published by some countries and some organizations, which are really nobody read. They are there to make money. They are there to get your $4,000 and publish in a journal with a low impact factor, and that doesn't help you, doesn't help the university, and I can assure you it's not reviewed very well. So avoid these messages, because they will make you, it's the same thing, they invite you to be the chair of a meeting in China, or a meeting in whatever, in America or somewhere there, and then at the end of the day, they ask you for $2,000. The same thing, you have to be very careful with online journals. There's many journals that nobody reads. So you have to be very familiar with that. Now, when we come to the how we can persuade the editor to look at our papers. Now, I want to tell you this is from an experience. I'm sure some of you have worked in the career board, but being an editor, the editor are overworked in general, and they have other things to do. I mean, apart from New England Journal of Medicine, which is like a full-time job, the other journals, a lot of the editors have many other things to do. And they need a clear message again. You see, I'll just give you an example. When I was an editor, I receive every morning before my breakfast 30 papers. And I'm only allowed to probably send for review 1 or 2 papers. So you have to attract the attention of the editor that your paper is an important one. It doesn't need to be complicated. It doesn't mean that you discover the cause of cancer, but it has to get the message clear to him that this is contributing to the work. And there's something that irritates, as I'm going to tell you, the editors or the associate editor, and he might just reject the paper from those simple things, which we will probably discuss. How long I have? Half an hour or 20 minutes, 40 minutes? Dr. Almighty? Okay, so these are things that you probably don't feel very important, but for example, the title, I always say the title should be very short and sweet. What does that mean? We receive papers, that the title is too long, 3-4 sentences. And now people like me who probably coming close to have an Alzheimer, it's by the time I read the first sentence, when I reach to the last sentence, I forgot what I read in the beginning. So please do not put those titles. You don't need to describe all your work in the title, half page of the title, quarter page of the title. The title has to be simple, sweet, and attractive to the editor, because that's the first thing he's going to read. A lot of people think that they will read from which university or from which place, and then I come to tell you about the Middle East story in a minute. But they said, because I am from this university, they did not accept my paper. But the first thing that attracts the editor or associate, because most of the paper co-editor go to the editor, but sometimes he was sent to the associate editor, and then the associate editor will send to the reviewers. And most of the good journal now, there's a very high chance of getting the paper rejected, quick rejection without even review. So please, when you got the title, try to tell the editor in a simple way, in a short way, why your paper is important. That is the message that I want to get you. Not avoid long sentences, avoid long title, because I can assure you, all a human being, when I saw this editor, title is saying, I have difficulty to understand what it is. Okay, next. Quick rejection. You got a lot of these things, which is called, I'm sorry to tell you that your paper has not reached a priority, and then we reject it. This has not, nobody has even read the abstracts. Now, something I found in the Middle East when I came back, and I don't know if it is in Turkey, which is people insist to be a sole author. There is no room for sole author in medical research. And if you are the sole author of a paper, and some of the university, they push for a promotion for sole author, and I tell them, when I see a paper of a research with a sole author, I put many question marks on the authority of this person. All work has to be done in a group, in collaboration. So, but we come to the limit there. So I hope that still our university and some of other universities in the Middle East, they insist that people should have sole author. And I'm telling them that this is not a good thing to really push our reviewer, because this sole author, who's checking on what he's doing? Who's checking on what's doing? And the other thing is, we all are busy. We're not in history. We're not in geography or something. In medicine, in medical research, work is all in collaboration. So that's to say that, also to say that there is no reason to have a football team authors. And this is, again, something that is ethically we should think about. We receive many papers from all over the world, from all over the world. That, there is co-authors, the message is very simple. There's like 20 co-authors. Anybody there, people always laugh. I think you have seen this slide. Maybe somebody will bring you the tea, you put them there. You're a friend, the head of department. There's no reason for the head of department to be a co-author. It's not ethical. You have to justify the co-authorship, somebody who contributes significantly to the paper. And when I read something, with 20 co-authors, I give you an example of one of the countries. You can see that I speak a lot about the Middle East, although I lived 40 years outside the Middle East. But for most of my career, when I was editor or associate editor, they allocate to me a lot of paper from the Middle East. And because I complain and say, that there is a bias against those people, and they send it to me, and that's where I communicate some of these things. So basically, you have to justify the co-authorship. What is the contribution? And now a number of journals, they want you to really justify it. Now, I received a paper once, which is the first author is the Minister of Health. And I could not believe the Minister of Health will have the time to go and do the experiments. So this is, yes, you want to please your friend, you want to please your you want to please your head of department, but please just make sure that we are dealing with scientific knowledge, we are dealing with ethics of publication, and people who are in the editorial board or the editor, they know that, and then they will not tell you why did you put your head of department or the dean of, when I came here, some people put paper, they put me because I am dean or vice chancellor. I said, why should I be in your paper? I did not do anything. Or you put the name of somebody because he is very well published, and you put him with your name. That is also something that is not ethical. And you have to make sure that all people that contribute, either sort of like in the idea, in the performance, in the material that you put them as the co-author. And I mean, I remember a paper which is very simple author, and there is 24, very simple message, 24 authors. And they said, if you can justify what these 24 authors did, I mean, I'm not speaking about guidelines. I'm not speaking about big clinical trial, but for research papers, please justify your authorship. Now, what are the things that the editor or the associate editor look at and make your, you know, what you need? You need to persuade the editor or the associate editor that my paper is worth sending to a review. That's what you want to do. And then the reviewer will really dissect your paper, because there's the layer, editor, associate editor, and then editorial board, and then, you know, reviewers. So you need to do that. And the first thing, we spoke about title, we spoke about authorship, and the abstract. This is the thing that will make your paper either reviewed or send a quick rejection. So, and a lot of people mix between the abstract and the introduction. You know, there's something you can put in, or even in the result. There's something that the summary, it should be condensed summary of the whole paper, but not in detail. You know, in that abstract, you need to tell the author, what did you do? What did you contribute to the knowledge? And what is the next step? What is the implication? The most important thing I want to read at the end, what is the implication, particularly clinical implication of your work? I know people do research for curiosity, but you know, we don't want to publish paper for curiosity. You can justify your curiosity and at a time, but you know, you have to tell that you did this work because there is a lack of information. You contribute to the knowledge, and that has implication in the abstract. You don't need to put all the negative results. You don't need to basically put detail in long. And please follow the follow the instruction. They tell you 200 words, do 200 pages. Don't do 210, because you know there's something called managing editors. And I'm sure for all you know, before it go to the editor, people will look into the number of words, and they will look, as you know, which is a problem, a major problem, into the sort how much of your text is copy and paste, which is the plagiarism. They allow maybe 10%, but you know, so it's people who I'm going to show you in the introduction, there's people who just copy a whole introduction from another paper. So this is going to be discovered. And I'm going to tell you also something that has been recently emerged in a minute when you speak about the introduction. So your room, your door to open for your paper to get accepted is you have to convince the editor that, okay, this is a good work to be reviewed, and give me a chance to get this paper reviewed. And so it has to be something which is attractive, timely, you know. That's why when we have a disease, new disease like COVID-19, you know, this is something that will attract the attention, but in the first few months, but later on, it's becoming too many people doing it. So see what is the fashion around, what is the need internationally in your country, in the world, and try to publish your paper to basically meet these needs. I mean, in our university medical college, which is not a big one, I mean, in the first year, our investigator, which are not that long, we published almost 250 papers in COVID-19 because we focus, you know, even me who have no time to drink tea, you know, I published like 26 papers because this is a need to fill some information. They want to know what's happening in the Gulf. They want to know why should patients are not dying in the Gulf. They want to know what is the result of the vaccine that is the first time we introduced before any other country. That is an information that the world want to hear. They're not interested in hearing about a case or some sort of epidemiological study here and there. So you have to be very political into the writing the abstract, choosing the title to get your paper accepted. A lot of people, so you got your abstract read by editor, by the associate editor, and this is now going to be sent for the review. So what is the reviewer going to say? The reviewer will not, he knows the abstract has already passed the editor and the associate editor, so he will not read a lot. He will go to the introduction. And that's where a lot of people have a problem, and also they mix introduction with discussion. So introduction, maybe 20 years ago, 30 years ago, we used to write long introduction review of the articles. Now, a lot of the journals, they have a limit. They have a limit how many pages they can publish. So please, please do not write the whole story, the whole life story in the introduction. The introduction, what is the important thing in the introduction, the message that the editor would like to see, is you prepare him for the method and the result. What does he want to do? To know, is there is a lack in the literature in that field? So that's where we go to the rationale. Mostly, you reviewed, you don't need to review now. There's millions and millions of papers. You cannot review all that papers. So you have to really summarize that things has been published or things has, and then there is some lack in the information in this area, or there's a special case for this disease in this part of the world. And that is why I did my research. Not because I want to do something, to get the person now is ready to read, okay, there is a rationale here, there is a need, and it should not be long. And in the introduction, a lot of the cut and paste that we notice. A lot of people, whole paragraph, they get put it from one side, from one paper, even in if it is your chapter, even if it is your thesis, even if it is your previous paper, do not copy. This is not your right to copy from. Because the system will discover that. And then once you discover, once they know that you have copy and paste, then you are in trouble. Now, some people, what I just want to warn you, some people that what they do, there's a whole system to discover copy and paste. I don't know, Dr. Armaita, if you have this system, but there's some people, what they do, there is a program to defeat that program. So we know that, because when you read and you see dots or commas in the wrong places, we always discover that there is something wrong. Or when we do the cut and paste sort system or run the system and it tell you there is zero sort of overlap, that there is something going wrong, and there's many programs now that clever people in computer have created, they sell it, even some universities use it to defeat the program in the editor. And if they discover that, we have some tips. I'm not saying that we always discover it, then this is not ethical, and to use any program that will avoid the program that discovered the plagiarism. So maybe people are not aware of that, but I'm sure students, and we learn that more also in the distance learning, that people are using the system. So you prepare the editor, there's a rationale, and now for that rationale, you tell him this is the hypothesis and this is the objective of your study. So he's ready now to see how did you do that, in a simple way. So that's where we go to the material and methods. And one tip to you, just to tell you, the same way you wrote the abstract, the same way you go into the idea in the introduction, go into the method. Don't mix, because the reviewer is basically building his ideas about the consequences of the events. So don't make the method going up and down. The method should follow simple thing. This is the objective. It should follow the objective. For objective 1, for objective 2, for objective 3, we did 1, 2, 3. Don't start with objective 3 and go to 2 and go to 1. You have to be very systematic. And nowadays, we do not accept a lot of the method to be long. It can be into the appendix. A lot of people method are repeatable. If you do, for example, a say or something like that, it's all repeatable. You don't need to say it. What we need to hear from you is if you have done any modification to the method or two. And it's important to know the source of the material. This is important. And that's for the clinical research. Ethically, you have to be very careful. Did you take the right consent form? Did you take the right ethical approval? Sometimes they will ask you for those one, some of the journals they do that. A lot of people, ethical approval was approved and then taken. And then people realize that the patient has not been even consent to use his material for this research. You cannot use archive materials without the consent of the patients, unless you have the right ethical approval. We see a lot in pathology, for example. They go and they take and they do the cases and, separate cell lines, and that's basically non-ethical. The tissue is the patient right, and he has to consent to using his tissue for research. And a lot of people, they will not object because, you take a tumor or you take something, but we have to be ethically responsible. And we have seen many cases in the court where people have not taken the right ethical approval, and then they run into trouble. So the method should be simple, short. If you have detail, put it into appendix because you need more space for your result and for your discussion. Now, what about the result? So here you prepare the person that he has the rationale. Now, this is the objective. This is the method that I have used. Use 1, 2, 3. Now you present your result into 1, 2, 3. And that's where the result should be. So one thing, you don't need to repeat the introduction. A lot of people repeat the introduction in the results. It has to be, the author, the reviewer has set his mind. You want to see what has happened to objective 1. It should be short and organized, and you have to learn how to tell a story. It's the same way when people giving a talk. Some people giving a talk and they jump from 1 to Z and to then G and to A. Once you confuse, because here in the results, the editor or the reviewer almost has going to make his mind about your paper. So do not try to confuse him. Present to him. By the way, Umaitha, am I exceeding my time? How long do I have?
I think 5 more minutes.
Okay, I finished. I have 3 slides. Okay. So the result should be short, organized. They should explain the data that you have, and it has to be point by point, please. Now, if you have to put a figure, well, now we have a lot of program to put a figure, avoid 2 things. One of them putting complicated figure like 10 bars, 12 bars in one thing, and then I have to fish to find where is the main result. So be very careful to put simple and positive data. Don't put the negative data into the figure. Put the things that will supplement your writing in the results into that one. If you want to put any diagram, it has to be very clear diagrams there into your figure. It's not wrong to ask a medical illustrator to help you to do this. A lot of people who are not first language, English speaker language, they have problem with discussion. And now this is dangerous because here where I think that reviewer has made almost his mind and he's going to see how you are discussing your result and he's going to decide minor comment, major comment, reject or accept. That's what it is. So the result we have to learn it. Make the discussion, make other colleague read it. It should follow the same sequences and you don't need to repeat the introduction. You don't need to repeat the result. Discuss your result. What are the difference compared? What did you add to the literature? Where are you going from there? What is the shortfalls of your things? Try to preempt the attack of the reviewer by telling them, yes, I know now after 2 years of research that I should have done this, but for this reason I haven't done it. but that discussion is the most difficult part of the paper to write. And the message to you is please do not mix between discussion and things. Now, you all know the decision is accept. Very rarely we give accept to people. Accept with minor revision, then it means that 95% of your paper is accepted. Accept with major revision, it means almost 60 to 70% that your paper will be accepted if you respond to the reviewer. Please, please do not argue with the reviewers. You might be wrong, but do not argue with it. Or it could be rejection. And now we see a lot of what we call a quick rejection, which means the paper has not been reviewed. So what do we do if the paper rejected, When I came here, I saw a number of faculties. They have like 20 papers on their desk. They all rejected. They got so upset. Oh, they don't publish my paper. They don't do that. Do not give up. Rejection is part of our life. So if it is rejected, it might be the wrong journal. I have done something wrong. So don't give up. Don't panic. Read the reviews. A lot of people don't read the reviews. And try again. There's 5,000 journals there. And do not take the review personal. Ask a friend to read it for you. It's not personal. It is something that the editor doesn't know me, doesn't know you. The editor is sitting there trying to accept the best in his mind acceptable. And if they ask you for a reviewer, please, please do not suggest your friend. The worst reviewer is your friend. I have seen that people suggest their friends or somebody who think you will give them a good review, and those people, they reject everything. So not suggest a friend, suggest somebody who know your field, and that is the thing that they're going to give to you. I can speak more, but I know that my time is short. I think the message is to you is that writing a paper is a skill that you can acquire, but please do not forget the ethics that when you're going to do research on when you write the papers, and have a mentor, somebody who has published before you, who has passed through the experience, and I'm sure that your paper will be accepted and you will be able to disseminate the knowledge that you have generated. Thank you very much.
Thank you, Professor Hamid, for this inspiring talk. It's always good to hear about the hints. And now I would like to leave the podium to Professor Sasa, and we're going to hear from him.
Yes. So thank you very much to Professor Rumeysa Kazançoğlu for the invitation to the university, also for the excellent organization of this webinar series. I also want to thank Professor Hamid for having presented so well also some concept that I was planning to also mention, so that will make it much easier my presentation, because I fully agree with him. And I think also, if I may say, also the personal experience, because when I first started to write papers also, I didn't know much. And if I go back to the first things I wrote, really, I don't much, see the quality and especially the structure and, what he said. So I think what he said is very useful for young people. I hope many young people will listen very carefully to him. And also what he mentioned, now is very common in university to have these courses on writing papers. This is, I think, is a very good idea. Every institution should expose, even at the level of master's students or bachelor students, to already be exposed to a good way to write papers, because I think that my generation was more like swim or drown sometimes in this field, but nowadays we can provide a very good training at the beginning. So I will try to be fast. I know it's a bit late. Also, if we want to leave at the end some time for discussion, I think it's good that maybe some of the colleagues online will have some questions. So I will share my screen now, and I will try to be fast. So okay, very quickly, my university is Sapienza University of Rome, as a research-intensive university in Italy, and this is the website also in English, uniroma1.it. Let me start very briefly. Before writing papers or publications.
We need to see your screen. We cannot see it. At least I don't.
Sorry. Sorry, I forgot to share it.
Thank you.
Yeah. Thank you for having. Okay, so I think now you see my screen, right?
Yes, indeed. Thank you.
I'm sorry, I forgot to share. I was too fast. I have to slow down a bit. Okay, so basically, as I said, this is my university, the website, and then I wanted to mention very briefly that before starting to write a publication, we need to actually do the work, and then, in my opinion, it's still very important for young people to read and study very well, things in their field. Sometimes, we forget this very important thing. There are now millions of articles available in databases like, PubMed, Scopus, and many others. It's not easy to read everything, but I think it's easier today than in the past to try to understand which are the main challenges in each field. So I really recommend to young people also, of course, with the help of their supervisors, to read very carefully the literature, to read the reviews. I think reviews are very important for them because they can summarize some of the main concepts. Books are also good, but sometimes it's not easy to find updated books. And I think reviews are a good, probably a happy medium between books and original articles. Of course, the databases are many. Some of them are completely free, such as PubMed, but also, of course, I recommend to all institutions to have a good collection of databases such as Scopus, Science Direct, Web of Science, SciFinder, and Access Medicine, because they really provide good knowledge. For instance, Access Medicine is relatively new at our university. It's a database of McGraw-Hill, which actually has most of the important books of McGraw-Hill completely online, such as the Harrison, Goodman and Gilman. These are very important books in the biomedical and pharmacological field. And it's very useful, in my opinion, to look at the books online because you can search by keyword. You can easily, print the parts that you need for your work, etc. So I think it's a good investment for universities to access these databases. Also, just very quickly to mention another problem that we have today, because having so many papers, sometimes also the challenge is to remember what you read, because maybe you read something very useful and interesting, and then after a while you have to go back and say, yes, I want to quote that author, but where did I read that concept of that? So this is something also important to try to find your own way to remember exactly what you read and what is important. Also, meetings, of course, are very important in laboratories, laboratory meetings. Also, conferences are essential. But on the other hand, it's also important for young people not to go to too many conferences, because each of them is time consuming. You have to prepare, maybe you prepare a poster. There is a lot of work behind each participation. So I think you need to balance when you're young, traveling with, work, let's say, on the bench, or at least in the faculty. Even, of course, if now with the COVID, things change, we don't travel much anymore. But we hope that after the COVID, of course, it would be possible to travel again. But my actually suggestion to young people is don't go to too many conferences. Try to go to the conferences at which you can present maybe an abstract or a short talk or something like this. Networking is very important. I really recommend to young people to use a ResearchGate as something that I find very useful. It is completely for free. And there you can actually, have a reprint request. You can contact colleagues and have a lot of interesting, exchanges. Also, another important point is how much you want to risk in your research. Of course, if you have a very competitive and, risky research, you may get more important results. But on the other hand, again, here you have to balance, because very often you need to finish a PhD, you need to, be promoted maybe at a certain point. So you also need some good publications for that. So sometimes very risky research can delay sometimes the publication. So again, here you need to balance. We'll go fast here. Of course, you try to have a high impact. Interdisciplinarity, this is also very much debated in higher education. Of course, this is a picture from one of the geniuses of history, Leonardo da Vinci. But I think for us normal people, it's not easy to be an excellent painter and an excellent engineer and anatomist, etc. So basically, again, here you need to balance and see how much you can actually broaden your scope of research, because if you do that too much, the risk is that your research will be a little bit shallow, and so again it will be more difficult to obtain good results. Let me go back very quickly to what Professor Hamid also said. I mean, this culture of the publish or perish. Of course, we are all in this culture. We need to publish. In our CVs we have impact factor, H index, and again here is good and bad, this process, because I remember in Italy when I was a student, this let's say bibliometric analysis was less common, so it was not so easy to find the impact factor of a professor or H index. And this, the risk at that time was that people were claiming, I have 300 publications, 400, and then you were looking at these publications and their value was very low. Here, using these bibliometric factors, you can be more sure that, if you have a very high H index, indeed, I think your role in that field is quite important. But I think that these parameters should be taken with a grain of salt, of course. They are not the only factor, but still I believe that it's important to consider them. It's not too early to avoid completely the evaluation. I think, especially I have to say in the STEM sciences. Of course, in the humanities and social sciences, this is completely different. But if we look at biomedical field, of course, in my opinion, H index and impact factor are important. Open access, also Professor Hamid mentioned this. There are many now types of journals. Some of them are so-called open access, which means that they actually do not sell subscriptions to libraries. So basically, these journals, they provide articles for free on the internet. But of course, somebody has to pay for the work behind the publication. And so these journals, they charge directly the authors. So the authors to publish in these journals, they have to pay a fee. The thing is here, we have to be very careful because there are some very good publishers, open access. Let me mention, for instance, Frontiers or MDPI. These are very serious open access publishers. On the other hand, young people should be very careful about the so-called predatory journals. I'm sure all of us, we receive every day at least one request and say, look, you're so good, we want you to publish an article with us on this and that. Okay, in many cases, that is kind of phishing. These journals are not very serious. They want to attract publications, but they are not very serious. So again, here you need to balance. And in my view, it's good to publish in open access when it's possible, because you leave open to the whole humankind to say that publication. Otherwise, you have to go to a library to get it. And on the other hand, we have to be careful again to the quality of open access journals and not to publish in predatory journals. Also, patent. This is another important aspect for young people. Try to patent if you can. Of course, this can be good for you, but can also be good for your institutions to try to have, in a way, possible profit from the research that was funded by the institution. So in a way, the money invested in some researches can actually go back to the institutions in terms of royalties. I will go fast here. I will go a little bit fast also here to save time, because I want to reach one part that is important for me. So let me go. I will go fast here. Sorry, but I think to keep the time, it's better to go a bit fast. Okay, this is important. So this was already mentioned by Professor Hamid. The structure of a manuscript is very important. The way you write very clearly, in a very consistent and systematic way. This is very important. As he said, you have to prepare a publication that is easy to read, for the referees. If a referee will struggle to understand what you mean, in the end of the paper, may be rejected just because it is not clear and the value of what you prepare is not clear. And so you have this, of course, different sections from the title to the introduction, aim of the work, materials and methods. Just a suggestion to the young people. A suggestion from me is that, try to start writing from the results. Actually, this is my suggestion. You prepare your figures and tables so it is very clear what you have in your hands. After that, you prepare the materials and methods in a very consistent way. As Professor Amit said, if you start with a certain experiment and then you want to provide the results and the method exactly in the same order, do not change that. Otherwise, it will be very confusing for the reader. Do not use too many synonyms. I mean, this also can be confusing for the reader. So because people may think that you are talking about something different, maybe when you use a synonym of a word. And then you go, through the discussion, and then you go back at the end, to write the introduction, to the paper, and also the abstract. Usually I write the abstract just at the end because you want to exactly to summarize your paper at the end, making sure that you have the full paper in front of you. And then you can, go in circles, prepare the first draft, think about it, leave it there for a while, discuss it with colleagues, with critical friends, and then you improve it until you submit. And then if you get a rejection, as Professor Amit said, do not get discouraged. I mean, it happens to everyone. Sometimes, you can improve that paper. After a rejection, you can go back to the paper and see why that paper was rejected, and actually you can improve it and submit it again. I will go a bit fast here again. I will go fast because these are things that we already mentioned. So this is the structure of the introduction. You go from general concepts to more specific aspects, and then the aim of the work. On the contrary, the discussion goes exactly in the other direction. You go from specific comments on your results, and then you go to broad conclusions. What is the impact of your research in the field, etc., etc. Also remember to acknowledge, everyone that contributed to the work, the funding agencies, and you can also dedicate your papers to somebody, etc. Then when you submit, this is also very important. The submission. Do not submit your paper, of course, to more than one journal every time. You have to wait for a reply. It's not acceptable to submit to more than one journal. Sometimes you are asked by the journal to suggest referees. Okay, do not suggest your friends. This also is not allowed. You need to suggest some people experts in the field that you may know, of course. If you are a person that, working hard in a certain field, you may know different people. But these people should not be too close to you because otherwise, for them will be difficult to do a very objective evaluation of your paper. So I will go a bit fast here again because this is the review process. I will skip this part to save time. Okay, so this is, as you see, is a very important ethical issue. So ownership of the data. So be very careful with plagiarism. Also in the text, do not use, the same sentences. Nowadays, all journals, they check actually your paper with softwares which, can identify exactly, the sentences that you maybe took from other papers. Be careful with the conflict of interest. Be careful with ethical research issues. I will come back to this point later on. And also, again, be careful when you suggest referees. Do not suggest people too close to you. First author, in my view, in the medical field, should be given to the young person doing most of the work. So this is a lot of work for the young person, but then he or she will get the first author, and then the last author usually is the person responsible for the group or the person who actually was leading the research in the beginning. So this is very important. Also, the order of the author. So for young people, it's very important in the beginning of your career to get a certain number of papers with your first name. Plagiarism, as I said, these are some of the softwares which are available. So there's also something that journals check. So just be very careful with plagiarism. Okay. And then this is a publication that is available for free in open access that I author with another colleague from Belgium. So if you're more interested in these aspects, you can download for free, this publication. So, and now in the last part of my presentation, very quickly, I want to mention, do I have a few more minutes? Yes. I hope I have.
Yes, Professor, you have.
Okay. Thank you very much. Okay, so very quickly, I don't have time now to go through all the details of drug development, but I want to show just in this slide, that drug development, of course, has one part called preclinical in animals or in vitro or, without having, humans involved. And then we have a clinical part in which we do have humans involved. So there are issues in both aspects. Let me first mention that one big tragedy which happened at the end of the 1950s, is called the tragedy of thalidomide. So thalidomide was a drug which was given to pregnant women because, of course, this drug was a sedative and also effective against the nausea of pregnancy. And unfortunately, it caused a high number. We estimate about 10,000 newborns with some teratogenic effects, which means that their body was not developed correctly due to this drug, because this drug is an inhibitor of angiogenesis. So angiogenesis is the process by which new blood vessels are formed. So thalidomide can inhibit the formation of new blood vessels, and this actually is very important in the fetus. So, a drug like this should have not been given to pregnant women, but of course at that time we didn't know. These are the effects are really terrible, because see the arms and the legs of some of these kids, they did not develop well. This is called phocomelia, and it was a big tragedy in the early 1960s. Now the drug is again on the market as actually used in erythema nodosum leprosum and also in multiple myeloma. But from the point of view of drug development, this drug had a very significant impact on the legislation. So after this tragedy, there was a so-called Kefauver-Harris Act by the FDA in the USA, actually asking, before marketing any drug, a very extensive preclinical testing, looking at toxicity in terms of acute toxicity, chronic toxicity, teratogenicity, effects, possible effects like carcinogenesis, etc. So I will not go through all the details, but it's very important the effect that this tragedy of thalidomide had on drug development, and again raised a lot of ethical issues. And still now in the society, this drug is remembered as one of the biggest mistake that pharmacology in a way did in his brilliant history, because we have to say that we provided in the last century a cure for many diseases which were actually untreatable for millennia. So I think pharmacology in the last century did very well. We are just actually next year, 1922, for instance, it was the year of the discovery of insulin. So next year we will celebrate 1 century of insulin, and we already celebrated 1 century of aspirin. In 48, we will celebrate 1 century of cortisone. So we can say that in the last century we did a lot, but also of course some mistakes, and thalidomide was of course a big mistake. And the important point here is that animal experimentation became very important. So before thalidomide, actually animal experimentation was very limited. After that, actually, we started to use many more animals because, of course, the toxicity had to be studied better and everything. So this is an important concept for young people. I mean, animal experimentation is not something that was done in the Middle Ages and then we still do that. No, that is something relatively recent in the history of science, because we realized that it was important to check very well the safety of drugs before having these drugs on the market. But of course, we respect the animals very much. We try to reduce as much as possible the use of animals in research. The high majority of pharmacologists, of course, believe that it's not possible at the moment to eliminate animal experimentation. That would be too risky for, again, human beings, receiving drugs not tested in animals, like in the case of thalidomide. But on the other hand, we try our best to replace any animal experiment when it is possible, to reduce the number, etc., and also, again, to refine research to try to minimize the potential suffering, pain, and distress of animals during testing. So all possible procedures are done in a way that we try to minimize any possible distress for animals. So I will go quickly here on these concepts now for clinical studies to try to conclude now in a few minutes on ethical issues related to human experimentation. Also there we have some important issues related to the fact that, of course, medical doctors, they have this Hippocratic oath. So when they become a doctor, they actually, try to, bind to some principles in reducing and avoiding any harm to their patients, etc. This is you can find easily online the Hippocratic oath. But on the contrary, unfortunately, during the Second World War, in the Nazi camps, unfortunately, there were some crimes committed toward prisoners, and some of them were done by medical doctors. So there was another big tragedy. Because, of course, medical doctors were not supposed to be involved in those kind of very cruel experiments. And I'm sure you heard about Mengele as one of the most famous doctors at that time committing these crimes. And after this tragedy of the 1940s in the camps, the Nuremberg Code was actually published. And you see in the first part of the code, you have the voluntary, it is stated that the voluntary consent of human subjects is absolutely essential. So you cannot do anything on humans without their full consent. Of course, very soon we realized that this code was too strict. So imagine you want to give a vaccine to a baby who is a few months old. According to this code, you cannot do this because a baby is a human being and the baby cannot give you consent. Or you have a person in coma and you want to try to save his life or her life with experimental therapy. You cannot do this because that person cannot give you the consent. And there are many other examples. So basically, this code, we don't consider anymore this code valid in ethics. And this code was actually replaced by the so-called Declaration of Helsinki. So the Declaration of Helsinki, you can also Google it online. It was published in the first time in 1964, but then it was updated several times. And it is more modern, introduce ethics committees to look at some more complicated issues, and allows also experimentation with humans, also in cases in which you cannot get directly the consent from the individual, like a baby, but you have systems, which in place, which allow to do this kind of procedures. So I will stop here. This is my ResearchGate profile. So just to give you an example that I use what actually I was mentioning, and I welcome young people to get in touch with me through ResearchGate. Would be a pleasure. And also, this is my email address, luciano.saso uniroma1.it. So please feel free to contact me. Thank you very much for your attention.
Thank you, Professor Sasso. Great, another talk. And now I think it's time to give the floor to Dr. Asif Khan. Asif, do I see you?
Yep, I'm here. I'm here.
Okay,
Okay.
great. The floor is yours now.
Thank you. Thank you. Let me share my screen. Okay. Can somebody confirm? Can you confirm if
Yes,
you can see my...
your slides now.
Yep, great. Thank you. First of all, I thank the organizers for inviting me to this talk, and I thank the earlier two speakers for a wonderful overview of scientific research process and the nitty-gritty details of what needs to be done. And what I prepared, the title of which is Issues with Data Reporting and Arguments in a Scientific Research. And I prepared this with young students, fresh students who are entering the research world. So this is more for them. But for those seasoned researchers, I hope there is still something for you here. All right, so with that premise laid, let's carry on. Okay, so now it's always good to start with the definition, and I got this definition for an ethical issue from reference.com. I was looking for a paper, but I think this is so widely discussed, I think reference.com should suffice. So an ethical issue brings systems of morality and principles into conflict. So unlike most conflicts that can be disputed with facts and objective truth, ethical issues are more subjective. And therefore we have opinions and interpretations. And so that's quite a mouthful, but I think essentially we all understand what this is all about, and there are just so many ways to look into this. There are just so many discussions, so many aspects of this. And this is often a big course by itself. So it's we're not going to be able to do justice to this big topic through this 20 minutes of presentation. But I hope you get some quick aspects, some ideas that you want to explore further. All right, so very quickly, just to look at the scientific attitude of a researcher, the attitude of a researcher, scientific researcher. Now, we all do research, and our attitude is typically, driven by these three tripartite aspects: curiosity, we love exploring; skepticism, we doubt and we question; and of course, we must have humility. We must be able to accept when we are wrong. All right, so these three together have driven a lot of the scientific discoveries that we have seen. And and we, of course, naturally, as part of this, ask questions and answer those questions. And so we use scientific methods to construct theories, organize them, summarize, and simplify our observations. Luckily for us, our forefathers, ancestors, and I mean the field in general has defined this scientific approach to problem solving, which I think has worked very well, although there are some variants to this data-driven approaches. But in general, I think this works very well. So you have a question or a problem, then you propose a hypothesis, then you carry out to test the hypothesis. So you use facts, you do analysis, and eventually you get your data, you look at it, you look at the solution and you see whether it supports your hypothesis or it doesn't support your hypothesis. And so you get your answer, and answers are not the end, but the beginning of the next question, right? So this is a continuous cycle that has helped our society and the world at large. All right, and luckily, well, over the years also, various researchers have come up with a lot of different methods to facilitate this scientific approach. So in general, I mean, you can read about this, of course. In general, we have descriptive methods, correlational methods, experimental methods. I'm sure there's some other aspects too. What I think is important for students to know is, what is the difference between these different methods, how they are conducted, what variables are manipulated, and more importantly, what are the weaknesses of these manipulations. For example, for the experimental, we have independent variables that can be manipulated, and sometimes it's not feasible. You may not be able to generalize the results, and they may be, it may be not ethical for you to manipulate certain variables. In general, we got to know what methods we use and what are the pros and cons of each of those methods to be able to best utilize to solve the problem that we have at hand. All right, so now, sometimes we can only do so much with our eyes, what we see, and sometimes, not sometimes, but often we need some, rigorous statistical approaches to help determine whether something is significant or not significant. We just can't leave it to subjectivity. So, of course, there is also a lot of debate on that, the p-value of 0.05 and etc. I'm sure you've heard of that, but in general, it has served, the scientific purpose quite a lot. So we have statistical approaches to look into this and help us make certain decisions. All right, and of course, reasoning. All right, and so we have those approaches, those methods, and we have statistical ways to kind of measure, quantify, whether something's significant or by chance. Now, once we have done all that, of course, we want to describe our data, right? We want to present, and I think the speakers mentioned about your results when you prepare a paper, how do you prepare your figures and tables, etc. And this is, in general, I think we all are, I think, pretty good, but we've got to be careful. There are also issues when we present this. So at the end of the day, of course, it has to be meaningful, and this is what's really important. Like, not too many bars. If they're unnecessary, you may want to remove them. But we also got to be careful in terms of misrepresentation of these data that we are presenting. Just an example over here. So we have the same data presented in two different ways. Now, somebody looking at the left, on the left, might see, there's quite a difference between the different brands, and often we don't pay attention to the axis. We kind of ignore the axis. So there's like perspective bias, and then if you actually present it fully, like on the right side, then you get to see that the difference is actually very, very small, and the difference got amplified on the left side, right? So these are tricks or things that you often see in marketing gimmicks. So we gotta be careful. We gotta stay away from these things. And it's important that we present with respect to the full scale whenever possible. I mean, this is just one example. There are many more. And another scenario would be, your data might be until, maybe the highest is until 50, and you just presented up to 50. You might want to consider still showing it all the way to 100. Then people really get to see what's the gap. That empty space is actually has a meaning there. So, I mean, this is just some of the things that we want to bear in mind, remind ourselves when we are busy preparing our figures for presentation. Because at the end of the day, it's all about somebody reading what we have said, and they will take our work forward further. And it's important that we transfer the same conclusion that we have to them. And the best way to do that would be to present the data in the best way possible. Avoid all these biases. And of course, there are other caveats to watch out for. There's just so many. I'm just going to go through very quickly for some of them. Some of these you may be aware, may not be aware, but I hope. So let's just go through that. So, hindsight bias. So what is hindsight bias? So tendency to believe that, after everything is done, we would have guessed it. It makes so much sense. It's so obvious, and we kind of question the money we spend on the research, the time we spend on the research. It seems like common sense, but if we were to ask ourselves, okay, can we predict how is it going to be in the next instance? We may struggle. We may not know the answer to that. So these are biases that I think we often have, and we got to stay away from this bias, and we got to look at the research in an objective way, rather than push it aside by saying this is just so obvious, you don't even need to do research to publish something like that. All right, and then the next one is the false consensus effect. So, this is a belief that others agree with us more than they do. So we spend most of our, and this is largely because we spend time with people who are like us, and also share our attitudes, share our habits. So we mistakenly assume that these people would be in agreement, and we kind of think that's the population at large. And, so you have this false consensus in your mind, and you kind of ignore the other part, that may not actually agree. In fact, there may be more who do not agree with you, right? So we got to stay away from this false consensus effect. Confirmation bias is another one. We seek out or notice evidence that will verify. So in some sense, we are looking out for things that will just support what we have in our mind or what we are trying to prove. We got to stay neutral, and even if it doesn't prove, doesn't support, we got to be open to that. But I know it can be hard, because we spend so much time and we are just hoping that it will support what we have in mind. But we should try our best to stay as neutral as possible and not have this confirmation bias affect us. There are so many more biases. In the interest of time, I don't think I can go through. I've got to monitor the time. I don't think I can go through all of these, but I hope you can take a picture of this and just read about it yourself. You have so we've gone through confirmation bias. There's something called belief perseverance, representative heuristic bias, availability heuristic bias, anchoring and adjustment heuristic bias, correlational study biases, illusory correlations biases. All right, so there are quite a number of them, and I think we all should be aware of these. Maybe we are aware, we just didn't know there's a name, and if there's, now that we know the name, we should be able to explore more, read more about these biases. All right, now shifting gear a little bit, now that we know about these biases, when we write papers, especially in the discussion, after we are done with the results and introduction method, this is where we make a case of our finding, right? What is so exciting about what we have found? What does it mean? What is the interpretation? So when you do that, you often make arguments to make certain conclusions. So it's also important that as students, of science, we all are students of science, we should know what are the different types of arguments. How do we argue? Which argument type are we really applying over here? So what exactly is an argument? You could take an argument as a reasoning or one or more premises that we use to reach a conclusion. All right, so these can be actually divided into three major types of arguments. So you have inductive, we have deductive, and we also have retroductive arguments. Let's go through this. Actually, deductive is the strongest one. This is typically what the police usually do when they do investigation. But let's start with inductive. So we have a result. Let's say Socrates is mortal, and we have a case whereby Socrates is a man. Therefore, we make a rule: all men are mortal. All right. So you start with a result, an observation. For a specific case, and then you kind of generalize that. That's inductive. Deductive, on the other hand, you have a rule. That's why police use this, because you have a rule that you could follow. It should be applicable in general, or most of the time. So we have a rule like all men are mortal. Then we have a case, Socrates is a man. Therefore, the result should be Socrates is mortal. Right? So you make that argument. And this is one of the strongest arguments. And retroductive is very similar to deductive. So you have a rule, all men are mortal, but you take a result, Socrates is mortal. Therefore, in this case, the case would be that Socrates is a man. All right. So these are just some examples. I, again, hope that you would explore this further. Now, we can, basically explore this further, dissect this further. So the arguments, let's look at the two strong ones, deductive and inductive. So what happens is, your deductive arguments can be either valid or invalid. So we got to be very careful how we make these arguments. And they can become invalid either because the format that we use is wrong or the content that we used is wrong. All right. So there are ways it can become invalid, but in general, so deductive ones can be either valid or invalid. And if they're valid, they can be sound or unsound. If they're invalid, they're definitely unsound. And on the other hand, for inductive, so it's not valid invalid because it's still a little there's still scope for that. It can be strong or weak, and if it's strong, it can be cogent or uncogent. If it's weak, then it's generally uncogent. All right. So this is how we can look into the validity of our arguments. All right, so now moving forward, now that we learned about the different types of arguments, they're actually fallacies of reasoning. They have a number of arguments, and there are fallacies in those arguments. So we got to be careful. In fact, people have come up with classification of these fallacies, and there's a number of them are very popular that we all should be familiar with. So what are these fallacies? Some definition, basically an error in reasoning of, compared to a factual error. So we're not looking at factual error, but an error in our reasoning of something. So where we make an argument, but the premise do not support the conclusion. All right. So and this could be like it's deductively invalid or inductively very weak. So there are some fallacies attributed to that. Again, you can read more about this. All right, so I want to just move on to some of these fallacies. So here I have listed 23 fallacies And these are some of the very common ones, like faulty cause, sweeping generalization. I mean, you can read by yourself. Some of my favorite ones are to quote equivocation, begging the question, circular arguments, straw man, etc. Right? So all of these are really fun and important that we familiarize ourselves. So I really, ask you to maybe go search on YouTube. There are a lot of videos that will explain each one of these and what do they mean. So please become familiar so you can avoid these fallacies from your own reasoning when you write papers, when you do research, when you argue, when you present your work to the scientific community. You want to stay away from these. It's good to be, in fact, it's important that we are aware of this. All right, so I'm just gonna go through some of these very quickly. So faulty cause essentially means lack of connection between two sequential events. Let's take the biological example. The transcription factor that I study is highly expressed in myocytes just before differentiation. And myocytes fuse to form multinuclear cinctia at differentiation. Therefore, the transcription factor causes the formation of that. All right, so this is two, there's no really connection between these two events, although they are sequential. We haven't really shown the connection. We cannot just jump to that argument. All right, so this is called faulty cause. Sweeping generalization from, I've reviewed a lot of papers too, and this is one of the things that I commonly see in writing by younger students or students who just started. Sweeping generalization. So what is true of the whole will also be true of the part, or what is true in most instances will be true in all instances. So that's what sweeping generalization states. So for example, kinase domains catalyze the phosphorylation of their substrates. Therefore, the two kinase domains of JAK both catalyze the phosphorylation of substrates. So I think this is a little too hasty and jumping to make that conclusion. Last but not least, faulty analogy, assuming that because two things, events or situations are alike in some known aspect, they are alike in other unknown respects. So for example, banning smoking in coffee shops in order to curb lung cancer makes about as much sense as banning chocolate to make the population slim. All right, so this is an example of faulty analogy, and there are many, many more. All right, so you have like fallacy, scare tactic, etc. All right, and there's a nice website here, Your Logical Fallacy Is. You could explore that further. All right, and there are many more websites about this. Now, I want to now switch gear now. So we looked at some of the issues. We have biases, we have fallacies in our arguments. How do we overcome some of these? Is there a way? Of course, being familiar with them is a start, but is there something that we should exercise, practice in order to kind of naturally, automatically, on a pilot basis, autopilot basis, stay away from these? And I think the solution to that is to practice critical thinking. Now, why critical thinking? So the problem is, we all of course think, and it's our nature to do that. But a lot of our thinking, if we leave it to itself, is biased, distorted, partial, uninformed, or downright prejudiced. All right. So the quality of our life depends on this, and yet if we don't do much about it, it's just going to do all these undesirable attributes. We're going to present in these undesirable attributes. So we got to nurture our thinking. It's not automatic. Maybe very few geniuses are automatically like that, but I think most of us got to train our mind to be able to think critically. All right, because shoddy thinking can be costly, both money and quality, and and excellence in thinking can be systematically cultivated. So what is the definition of thinking? Is the art of analyzing and evaluating thinking with a viewpoint to improving it. So I like to say, thinking about your thinking. So you think, we all think, but we got to think about what we think, but with a purpose to improve our thinking process, not just to think about what we think and then we stop at it. All right. So anyway, now what will be the outcome of something like that? A well-cultivated critical thinker. So these are individuals who raise vital questions and problems, formulate them clearly and precisely. They gather and assess information. They come to well-reasoned conclusions and solutions. They think open-mindedly with alternatives in mind and not just biases, communicate effectively in order to figure out solutions. So I think this is what we desire, our scientists, our students, to be nurtured towards being critical thinkers. In short, it's critical thinking is self-directed, self-disciplined, self-monitored, and self-corrective thinking. So it's a lot of disciplining that we have to do on ourselves in order to reach there, get there. And it requires rigorous standards of excellence and mindful. Now you may ask, okay, fine, this sounds great. How do we do this in a scientific way? This sounds like an art. Yes, over time we'll get there. Well, luckily for us, there's this organization, criticalthinking.org. They have compiled, some really nice ways for us to inculcate this systematically in our students, in our society. So they have basically broken thinking apart. So these are elements of thinking or thought. Elements of thought. So when we think, we got to think, applying all these elements. So what are these elements? We got to have a purpose for our thinking. We got to have questions at the issues. We got to gather the information. We make interpretation and inference, and we got to know the difference between them. We got to know what are the concepts that we utilize, theories, axioms, principles, models. We got to know the difference, and we got to know what we are using, what we are not using. The assumptions that we make, and the implications and consequences of everything that we have used. And of course, there has to be a point of view, a frame of reference in doing all this. There's a lot more that I could talk about this, but in the interest of time, I think suffice to say that there are elements of thinking, and we can actually learn more about each one of these, and inculcate this in ourselves, remind ourselves, and ask whether we are actually thinking, utilizing these different elements. What elements have we missed? What elements we underuse, and what do we overuse? And then try to improve them along the way. Now, these elements, it doesn't stop there. Knowing the elements is one thing, but you actually need to apply each one of these elements using universally intellectual standards. So they're actually standards that can help you evaluate. So you might be actually using all these elements, but are you using it the right way? Are you using it properly? Are you maximizing on all this? So we actually have intellectual standards to help us make sure, benchmark ourselves, whether we're really utilizing it in the best way possible. And there are like 1, 2, 3, 4, 5, 6, about 7. Actually, there are more, but 7, commonly used standards. So clarity is one standard. I think there's another slide. I might as well go there. So yeah, so we have clarity. Are we asking? Are we going through these elements using the standards? So is there clarity? Could we elaborate further? Could you give me an example? Could you illustrate what you mean? So you can use these questions to evaluate whether you have gained clarity, whether it's the purpose, whether it's the question, whether it's the information, and so on. All right. So clarity, accuracy, precision, relevance, depth, breadth, logic, significance, fairness. All right. There you go. So there are these different intellectual standards that we can apply. In fact, there are exercises that this organization provides that helps us, evaluate whether we are, practicing this the way it should be done. All right. And what will happen is, if we apply this, if we are cognizant of these elements of thinking, if we are cognizant of these intellectual standards, and we apply this in our daily life, and when we do research, not just in research, but maybe beyond our daily life, although it can be quite taxing and quite tiring to be remembering all this, to be asking all this all the time. But I think once we practice this in our research, it would probably also, have a ripple effect to our daily life, and hopefully improve our standards of intellectual curiosity and etc. Anyway, what happens is, when we apply these, what results and outcome of this is intellectual traits or virtues. All right, so we have several of these virtues that we hope to again inculcate in ourselves: intellectual integrity, intellectual humility, confidence in reason, intellectual perseverance, fair-mindedness, intellectual courage, intellectual empathy, intellectual autonomy. All right, so these are traits that we desire, not just in ourselves, but also our colleagues, our children, and maybe the society at large. So in general, we have these elements of thinking, that need to be, implemented with the view of the standards. So the standards must be applied to these elements, and we hope that over time, through this application, we will learn to develop these intellectual traits that would hopefully result in much more robust, rigorous scientific research and methods that we apply. All right, and this is not something that's automatic, that's easy, that's fast to be done. It's actually a journey. right? So there are stages of critical thinking development. We start off being unreflective thinker. Then basically we are unaware of significant problems in our thinking. And I think there are many of us out there who may be, those who are just starting maybe at this stage. Then we recognize these, and then we become challenged thinker. We are faced with significant problems in our thinking. We face it, we try to work on it. Then we become beginning thinker. We try to improve, but without regular practice. So maybe most of us who are already in, doing research could be at the beginning level. We have recognized. And then over time, as we stay on academia, we do research, we become practicing thinker. We can recognize the need for regular practice. And then eventually, we hopefully become advanced thinker. We advance in keeping with our practice. This is when it kind of becomes autopilot. And hopefully one day we all reach the stage of master thinker. Good habits of thoughts are becoming second nature to us. All right, with that, I thank you for your attention, and I hope this was useful. And I hope we all get to the stage of master thinker very soon. Thank you. Professor Reza, back to you.
Yeah, Asif Hoca.
Mehmet Hoca, yes.
Unfortunately, I'm not as nice looking as Rumeysa, so the listeners, I guess, have to. Professor Rumeysa had to leave, so I'm asked to basically close down the and get the first questions. Get first questions from the audience, and or any issues they would like to make a comment about. Then and obviously I would like to thank you. It was just a tour de force. It was very nice presentation, and Dr. Luciana Sasso, and as always Dr. Kutebe as well, and there was a quite actually participation from the crowd. If anybody has any questions, they can text or add I guess in the comments section or a chat section of the presentation. But until we get a question, I would like to maybe just shoot out one that comes to my mind to you. Now, with the critical thinking and asking the right questions, now we have this COVID pandemics, and a lot of us are trying to engage in research with this. So basically, not only identifying the questions to be asked on let's say on a COVID-19 in a haphazard way, without really going into details of the questions, how relevant, how accurate, how timely the question is, and then you get the data, and then you try to publish this through in a short period of time. What do you think the researchers at this juncture would probably face the most, and what would be basically the first elements that they need to be aware of? Because it seems, especially in the COVID cases, that many of the data seems very short-lived, accuracy of it, because the change is so fast. I'm not sure if I was clear in my question.
I think I got a rough gist of it. So I guess this is addressed to me, and I'm sure the other speakers can chip in. So I'll maybe start. So, well, COVID, we're still living in COVID. And when it started, there was a lot of rush to study COVID. And as a result, we saw, this bioarchive and these preprint servers were flooded with a lot of papers. And very quickly, these organizations, put a label that, these have not been peer reviewed. So we got to be careful with the conclusions that are made. So naturally, there's a pressure to get a lot of things out as quickly as possible. But I think, we got to do what is right, the right thing to do, that we have always been doing when there was no COVID, go through the rigorous process of this. But of course, that urgency, sometimes we just can't avoid it. For example, in the case of vaccine, we had to rush in order to get these. Otherwise, lives are being lost. So for some research, of course, the urgency is there. And I also think the regulatory organizations recognize these. So some lapses are made in view of that. So this is unprecedented, at least in our lives, our times, situations. So some lapses may be applied. But in general, I think we don't go through those situations, and we should be as rigorous as possible. And even when we are not rigorous, I think we should clearly declare the limitations of whatever we have done, so at least people are aware and apply or take your results with a pinch of salt, knowing the limitations, the drawbacks of what you have put out there, and they basically take it, absorb it with the risk in mind. And I think that's probably the best we can do. But I think identifying the important questions should still be the priority in terms of, there are all kinds of research we could do, and the data comes and is rapidly changing. So we just got to be, I think the best would be to just declare these limitations as part of our discussion, so we don't kind of, put it under the rug or anything like that. There's just so much else that could be said. I'm sure others, the other speakers would have something to add too.
Okay. I'm not sure Dr. Kutaiba or Dr. Sasso is online, but if not, any other questions?
I am online, but in this case, I don't have anything to add. I just fully agree. And I think Asif is more expert than me on this specific question, so I will not add anything.
So with the caveat, the open caveat telling, okay, this is what it is. And hopefully in a relaxed times we will have probably a lot more higher standards than the current situation, I guess. Then that can be printed or published. The bioarchive is probably a long conversation on its own, but we'll talk about that. Is there any other comments or questions from the audience? I didn't get any questions. So if not, I would like to thank Dr. Sasso and Asif and Dr. Kutaiba as well. It was very nice, very nice talk, especially for the graduate students. Many of whom is from our institute, I understand. And they will get tremendous benefit from this talk. Thank you. And thanks for the audience. And I guess we'll just sign it off now. Thank you.
Okay. Thank you for the invitation. Bye-bye then.
Thank you for all. Bye-bye.
Thank you.
It was a pleasure.
Bye.
Okay. Bye.